Now let's take you to today's perspective. And here in Europe, the recent coronavirus vaccination programme has been slowed quite considerably, partly by the hesitancy of people to get the AstraZeneca vaccine. Now, the fears of blood clots meaning people have favoured alternatives. And yet many women have pointed out that the actual risk of fatal thrombosis from the vaccine is significantly higher from taking the pill. And yet that is still prescribed to millions of women, well, with little concern. Now, it's one of the issues which is tackled in this new book, Unwell Women by Elinor Cleghorn, The Battle for the Female Body. And she joins us now for today's perspective. Thanks very much for being with us on the programme, first of all. I mean, let's start off by talking about that one specific issue. I mean, you say in the book that the side effects of the pill is just one issue that's been downplayed, if you like, for years.
It has. And in the 1970s, in the 1970s, when women were sort of taking stock of the side effects that were coming from the pill that was brought to market in the 60s, many were going to their doctors to complain of side effects like pain, say weight gain, and say things associated with blood clots. And many were finding that they were being dismissed by their doctors, or they were being told that their side effects were not down to the pill. And this actually caused a lot of change. It forced change into the concentration of hormones that were in the contraceptive pill. So there is a really long history, I think, of women being hesitant about public health interventions and the side effects related to them.
Do you think it's changing, though? I mean, we are seeing, let's face it, an awful lot more women now in the health service.
Absolutely, we are, and especially in entering medical schools. I think that now in the UK and the US, that women are just slightly outnumbering men as they enter medical schools, which of course hopefully will lead to a change or a more gradual change in the medical culture to make it more accommodating of women's particular needs. And I also think that this issue of women feeling like they're being dismissed and disbelieved by their doctors is becoming more credible as an issue for research. So hopefully we will see some implementable changes that really look at how doctors' perhaps dismissal of women's concerns about their health impacts things like their diagnostic times for diseases, and also things like the uptake of the COVID vaccine, for example.
And presumably it's also a case that it's not just in the medical profession, is it? I mean, in all realms of life, women are having much more of a say, much more of a 50-50 balance. And even in their minds, perhaps women are thinking, no, this isn't right. I can fight for something better here.
Yeah, absolutely. I think that especially over the last few years, when we've seen a real cultural turn towards women speaking out about their experiences and the discriminations they face across many sectors of society, that we are, coming to a place where women are not silenced in the same way that perhaps they were in the past, and they're sharing these experiences and really calling for more equitable treatment. So you're completely right. It's not just in medicine. It's demonstrative of, more social change and cultural change.
We gave that one example of the beginning, the pill and the AstraZeneca vaccine, but there are so many others, aren't there, as well, that highlight this issue and promote it, if you like, as well.
There are. And in my book, Unwell Women, what I really wanted to write about is to reflect on the history of how we got to this position we're in now, where we understand that women are facing a gender gap when they try to get treatment for their illnesses, diseases, and health conditions. There's been a lot of research that has shown that women's pain, when women report pain in hospitals and also to their doctors, that they tend to have that pain undertreated and underestimated when compared to male pain. And also, there are many complex chronic diseases that we know less about that affect women disproportionately than men. So the book was really my attempt to tell the story, the narrative story of how we got to this point today, where we're facing these gender gaps around our healthcare. And so I went back to the beginnings of our Western scientific medical canon in ancient Greece to really build up this picture of how we got from there to the present in a largely male-dominated medical culture, and how that medical culture produced some of the ideas about women's bodies and lives that perhaps we're still feeling the sort of residue of now when women are trying to get adequate healthcare.
Eleanor, where's the idea for all this come from the book? I mean, I know that you suffer yourself, don't you, from an autoimmune disease?
I do, and I was diagnosed with an autoimmune disease in 2010 after a complicated pregnancy where my unborn son had a heart condition that was at first very mysterious. And it turned out that my own immune system was actually creating a cell that was attacking his heart. Now, I was diagnosed with this autoimmune disease quite soon after that, excuse me, after becoming fairly unwell myself with a heart condition. But for about 7 or 8 years before that, I'd experienced what I now understand are the characteristic symptoms of this autoimmune disease, which include joint pain and swelling, and sensitivity to light and heat, and other strange symptoms like migraines and nausea. But every time I went to my doctor to try and seek some answers for what might be happening, I was usually dismissed as being hormonal or anxious or just as having nothing wrong, nothing to worry about. I was never referred for any further diagnostic tests, never referred to a specialist clinic, and never given any sort of appropriate or adequate medication for my pain. So the idea to write this history, Unwell Women, was really inspired by that experience that I had had of being dismissed by doctors and also going on a long journey to find out answers about what was happening in my own body. So I expanded sort of beyond my own experience to want to go back to the beginning and really figure out why. Why not just me, but thousands and thousands of women like me go through similar experiences when they just want answers and adequate treatment about what's happening in their bodies.
And then just time to ask you as well, I mean, you take the book a little further as well and don't just talk about women, about the fact that race and class also has a real impact on the way people are treated.
Yes, I do. I think that, these things, these terms that we hear, like the gender pain gap, for example, or the gender health gap, that describe how women are disproportionately affected, within the medical system. Of course, that those discriminations and disparities get much larger for Black, Asian, Latin, ethnically diverse women who face historical biases against their pain and against their ability to articulate what is happening in their bodies. And this is something that is really ingrained since the 19th century, and we see the ramifications of these racial disparities now in the treatment, for example, of Black women while they're in labor, that they face much higher rates of maternal morbidity, for example. And we know that racial bias is a real issue, that it is present, that it's often unconscious or implicit, but it is there, and it means that means is greater disparities and more severe health outcomes for people of color, and also people who, as you say, where there is also a class disparity or deprivation issue. So those determinants as well of race and, as you say, of class really also sort of magnify those gender gaps around our medical and healthcare.
Eleanor, good to talk to you. Thanks very much for joining us on the programme. It's Elinor Cleghorn, the book Unwell Women, The Battle for the Female Body. Thanks very much for today's perspective.